Hello and welcome to today's webinar. I am Trevor, the Communications Manager for the Canadian Cancer Survivor Network. Thank you everyone for attending today's webinar, which continues our Fall 2023 series. Now, if you're new to our webinar, a little background on our group. CCSN is an organization working with cancer patients and survivors to learn about the complexity of our health system, connect with others to plan action, and to act on those plans to better create outcomes and healthy survivorship. Please visit our website to find all the information about what we're doing in events, news, and of course, our webinar series. This webinar is being recorded and will be available on YouTube, and you will be provided with a link to this webinar and the slides whenever it is uploaded. Now, we will add a Q&A session at the end of this, and so if you have a question, there is a questions tab on your GoToWebinar screen. Type in your question there, and we'll be happy to answer it at the end of the presentation. Feel free to type in your question at any time. And now to present our presenter. This is Cassandra. She is a Senior Manager of Programs and Education at the Colorectal Cancer Resource and Action Network, or CRAN. She oversees CRAN's patient-focused and evidence-based portfolios serving the unmet needs of colorectal cancer patients and caregivers across Canada, and collaboratively leads CRAN's educational initiatives both for patients and healthcare providers. Cassandra is a medical radiation technologist with a graduate degree in health studies and leadership. She has worked in both patient-facing and project management roles and led a startup of 2 nuclear medicine programs which improved access to diagnostic imaging in her community. And so without further ado, I would like to give it to Cassandra for her talk, Early Age Onset Colorectal Cancer.
Hi there. Thank you so much, Trevor, for the kind introduction. I'd really just like to begin by extending my thanks to CCSN for the opportunity to speak today about early age onset colorectal cancer on behalf of CRAN. I sincerely appreciate the opportunity to address this important topic, and I'm so thankful for everybody tuning in. Next slide. So we'll begin today with a quick introduction to CRAN, and then I'm just going to provide an overview of colorectal cancer before jumping into how this disease is really impacting younger Canadians. Then I will be joined by a wonderful stage 4 colorectal cancer patient who is currently thriving while living with this disease. We'll wrap up the webinar with information about support and resources available for patients and caregivers during this journey before taking questions at the end. Next slide. So who are we at the Colorectal Cancer Resource and Action Network? CRAN is a national patient-focused advocacy group that champions the health and the well-being of Canadians touched by colorectal cancer and others at risk of developing the disease. We provide support, education, and advocacy to patients as well as their caregivers to really help improve patients' quality of life and their longevity. CRAN has recently expanded our patient-focused mandate to serve tumor type patients, multiple tumor type patients, and we're doing this in our HTA patient evidence submissions, our educational events, and our advocacy initiatives. And ultimately, what we're trying to do is reduce the burden of cancer in Canada. Now, let's talk a little bit about colorectal cancer. So the pathology is most often an adenocarcinoma, and it's a cancer that originates in the colon, which is also referred to as the large intestine, or in the rectum. And this collectively is known as colorectal cancer. Now, the malignancy most often begins as a benign growth or a polyp in that inner lining of the colon or the rectum. Over time, some, but not all, polyps will turn into cancer. Now, since polyps can be removed when they're detected early at the benign stage, colorectal cancer is actually considered a preventable cancer. It's also highly curable when caught early. Next slide. Undetected, the tumor will begin to penetrate the layers of the colorectum, and that's what we see with stage 1 and stage 2 cancers. Eventually, it will spread into those lymph nodes. You can see those little green lymph nodes on the screen there surrounding the tumor, and that's when it's considered a stage 3 cancer. once the cancer has penetrated that entire wall of the colorectum, invaded those regional lymph nodes around the cancer, and then spread into the distant organs, that's when it's then considered a stage 4 cancer. So the most common sites of colorectal metastases are the liver and the lungs. And this is followed by the peritoneum, which is that lining that's surrounding the abdominal and the pelvic organs, the bones, the ovaries, and then the distant, the far away lymph nodes. Okay, and just moving along to some facts and statistics on colorectal cancer. So colorectal cancer is actually the second leading cause of cancer death in Canada. Following lung cancer, colorectal cancer is the next leading cancer killer of Canadians. And despite this fact, it really doesn't get the awareness that it calls for. So certainly my thanks goes out to each person listening today, which really collectively helps us to improve and raise awareness. It is the third most commonly diagnosed cancer, both in men and in women, with 66 Canadians diagnosed each day. In 2023, it's actually estimated that 24,100 Canadians will be diagnosed with this disease. The average person has a 6.3% chance of developing colorectal cancer over their lifetime and a 2.9% chance of dying from it. Sadly, 25 Canadians die each and every day from colorectal cancer. The projections indicate that we will have lost 9,300 Canadians to this terrible disease in 2023. But the good news is that colorectal cancer is largely preventable and highly treatable when caught early, and as many as 9 out of 10 cases are actually curable with early detection. Next slide. As a nation, Canada actually has one of the highest incident rates of colorectal cancer in the world. Symptoms of colorectal cancer are often vague, they're often dismissed, and sometimes there are no symptoms at all. And thus approximately half of new cases are diagnosed at stage 3 or stage 4. This is a disease that affects both men and women fairly equally. And though rates of colorectal cancer are currently declining overall, and this is in large part due to screening programs, unfortunately, both the incidence and the mortality are expected to increase beginning in the year 2030. And this is largely going to be driven by younger Canadians, those currently under 40 years old, which we will talk about in greater detail later on. So colorectal cancer is, it's often perceived as a disease of older men for some reason, but this is not always the case. Early age onset colorectal cancer is generally defined as a colorectal cancer that is diagnosed in an individual under 50 years of age. And every week I speak to people in their 40s, in their 30s, and sometimes even in their 20s who have been diagnosed with this terrible, terrible disease. It's very important to note that contrary to the declining rates of colorectal cancer that's observed in Canadians aged 50 to 74, which is the age that qualifies for screening in Canada, the incidence of colorectal cancer has been rising in Canadians under the age of 50 fairly rapidly since the year 2000. Many are actually describing these rising rates as a global epidemic. And this is not something that is just happening in Canada. Researchers have identified what's called a birth cohort effect. And what this means is that since 1950, each successive generation faces a higher risk of developing early onset colorectal cancer. So to put this into perspective, the population born since 1980 is now 2 to 2.5 times more likely to be diagnosed with colorectal cancer than were our parents' generation at the same age. Next slide. So this leads us to the big question of why. What is causing this epidemiological shift? And the answer is almost certainly multifactorial, but let's dive into some of the potential causes or risk factors for colorectal cancer. Note that these factors are applicable across age groups, though it's suspected that the younger generations may have had and continue to have increased exposure to some of these risks. Current research is actually suggesting that it's the early life exposures. And this is more likely, late childhood into early adulthood that play a significant role, though exposures may begin even before a baby is born. Lifestyle risk factors include having a high body mass index, physical inactivity or sedentary behavior, the Western diet, things like processed foods, red meats, not enough plant-based foods. Alcohol, this isn't something that everybody likes to hear, but the evidence for alcohol as a significant risk factor is just more and more compelling. Smoking, of course, and maybe sleep pattern changes. That's something that's being currently investigated by researchers. Environmental exposures are likely to play a role. Again, this is something that's happening from early life, and this includes things like water and air pollution. Exposure to night light is actually something being investigated by researchers as a potential risk factor or contributor to the disease. And the gut microbiome is emerging as a potential factor playing a very strong role in cancer risk. So the microbiota can essentially be thought of as its own organ, and one that's made hopefully of a very diverse group of bugs. And this diversity actually plays a significant role in the gut health. So the microbiome is influenced by diet, of course, but also things like antibiotic use and pharmaceutical use, as well as things like where you live, your stress and exercise levels, and where you fall within the life cycle. It's something that actually changes over time. And then we have the factor that we can't do anything about, which is genetics. And while genetics can certainly increase risk, it's really important to note that sporadic cancers account for the vast majority of cancers. And a lack of family history can actually be something that's perhaps falsely reassuring. For most cancer patients, gene mutations are sporadic. So they're caused by aging, they're caused by exposure to the risk factors we've just discussed. People are not born with these acquired gene mutations, and they do not pass them on to their children. That said, a family history of even a non-hereditary colorectal cancer does increase the risk. So we call this familial cancers, and they account for about 20 to 25% of colorectal cancers. And what this means is that there is a family history of the same type of cancer, but there's actually no identified inherited change in the DNA. The cancer is likely to be a result of shared environmental factors or lifestyle factors, or perhaps even an unidentified mutation. So hereditary cancers, the genetic cancers, account for only about 5 to 10% of colorectal cancers. And when this happens, there's actually an identified inherited genetic change in the DNA, and it's passed down from a parent to a child. A person who is born with this type of a mutation has it in every cell of his or her body. People who inherit these gene mutations have a higher risk of developing certain forms of cancer compared to the general population. And there are certain ethnic groups, such as those from Ashkenazi Jewish descent, and they're more likely to be carriers. Next slide. Despite the rising rates of early age onset colorectal cancer, younger Canadians remain ineligible for screening. Now, this is really something that, collectively, we need to make some noise about this. In the absence of screening, young Canadians are often diagnosed later and with more advanced disease. And the tumor biology itself is often different, and it tends to be more aggressive and more lethal. Next slide. A recent Canadian study actually extrapolated the cost savings associated with reducing the screening age. Since colorectal cancer is so expensive and so resource intensive to manage and to treat, and we know that screening is associated with prevention altogether in many cases, or earlier detection when the cancer is more easily treated, the modeling actually found significant health system savings associated with lowering the screening age. So here you can see that lowering the screening age to 45 is modeled to save $719 million in health system costs. And we could potentially save 1.1 billion with a B, dollars if the screening age were lowered to 40. Earlier screening is just a win all around. It's a win for patients at an individual level. It's a win for the overburdened healthcare system. And it's a win financially as well. And organizations like CRAN and like CCSN are working to raise awareness of this and to advocate for change. Next slide. So what can you do to aid with early detection? Perhaps you're watching this and thinking, okay, I'm ineligible for screening. I know I'm at higher risk based on my age. What can I do? And the answer is listen to your body. We hear sentiments from so many early age onset patients who express that their symptoms were dismissed as something benign simply due to their age. This is something that we hear over and over again. On the screen, you can see some of the symptoms of colorectal cancer to be mindful of in yourself and in your loved ones. Many of these symptoms can be vague, but they do require investigation nonetheless. Rectal bleeding is a very common symptom, particularly with our left-sided tumors that we see. It's something that's commonly dismissed as hemorrhoids. Now, if you're experiencing rectal bleeding, yes, it's true that it is more likely to be from hemorrhoids than from cancer, but our healthcare providers have an obligation to at least rule out a more serious cause such as cancer first. So if you are experiencing one or more of these symptoms and they're persisting, please speak to your healthcare provider about whether a colonoscopy may be right for you. Next slide. Thank you. So this essentially is just kind of a summary of some of the more salient points that we've just discussed. So if you're born in the year 1980 or later, you're 2 to 2.5 times more likely to develop early age onset colorectal cancer than your parents were. We know that younger people are less likely to seek medical care when experiencing symptoms, but they're also more likely to be dismissed by their healthcare providers. Unfortunately, if you're under 50 and you're not at increased risk due to your personal health history or a family history of colorectal cancer, you are ineligible for screening currently. And unsurprisingly, younger patients are more likely to be diagnosed with a more advanced stage disease. Next slide, please. So for those who have been diagnosed with colorectal cancer, treatment usually involves localized and or systemic approaches. Radiation therapy is something that's used in the neoadjuvant setting, so this means before surgery. And it's used in some rectal cancers to shrink the tumor prior to resection. When we have metastatic disease, so when the cancer has spread to other organs, radiation therapy is sometimes employed to treat the metastatic sites. Now, surgical resection is something that's used in the earlier stages of disease to essentially cure the cancer. So if the cancer is not spread, it can be removed, and that leaves no evidence of disease. For stage 4, or the metastatic disease, surgery can be used essentially just to chip away at the primary tumor as well as those metastatic sites. And there are some patients who are actually now being cured of stage 4 disease. And then we have our drug therapies. So drug therapy can be given either before or after surgery, or both. Chemotherapy is used alone in the earlier stage disease when it's needed, and it's used in combination with targeted biologic therapies in the advanced stage disease. So these targeted therapies, they're not chemo, but actually they're precision medicines. And essentially what they do is they act like a heat-seeking missile, and they're attracted to a particular mutation that is expressed by the tumor. And this is something that's determined through biomarker testing or comprehensive genomic profiling. Immunotherapy is a very promising newer treatment in which the therapy essentially prompts the patient's own body to attack the cancer. It's really quite remarkable, but it is only known to be effective with a certain tumor characteristic or a biomarker called MSI-high disease. Next slide. So I've spoken, a lot about the numbers and the figures and the factors related to colorectal cancer, but no one can better describe the impact that cancer has on an individual diagnosed with cancer at a young age than a patient themselves. And so I am very pleased to introduce Mr. Jason Abramovich, who is a stage 4 colorectal cancer patient and a member of CRAN's Young Adult Patient Advisory Council. Jason has kindly agreed to share his story and some of his insights and perspectives based upon his lived experience in battling the disease. Jason, over to you.
Yeah, hi. Thank you so much, Cassandra. Thanks everybody for tuning in today, and I just want to give CRAN as well a big thank you for giving me this opportunity. I just apologize for being in my car. I'm working today, and I'm back at work, which is an awesome thing. But the meeting went long, so what can you do? So we're here. I'm super excited to be able to share my perspective. This is something I'm really passionate about as a patient as well as an advocate in the cancer community. And I'm just, super excited to share my story and some of my insights. So I guess I'll start with today, just to then we'll backtrack a little bit. So today I'm 39 years old. I have a awesome wife, Leslie, at home. We have a little 3-year-old daughter named Kira. I work full time as a case manager for adults with physical and mental disabilities who live out in the community independently. And I'm super active. I run, I hike. I love being outside. And I'm also managing stage 4 colon cancer. So that all started about 3 years ago. So we can go back to when I was 36. Again, I was healthy, active, really was not doing any of those big red flag things that you're not supposed to do if you don't want to get cancer. I ate well. Life was going great. At the time, I was a firefighter. I was volunteering in my community. I was also a member of the armed forces previously to that. Helping people is what I love to do. And out of nowhere, I was suddenly in a position where I was hit with a diagnosis that I was not expecting. For lack of better terms, made no sense. I have no family history. I was, for the most part, living a fairly active and healthy lifestyle, and I started to develop at the age of 36 some very very mild symptoms, as Cassandra spoke to. That was so accurate that um, I love listening to that because so much of it resonated and kind of from a different perspective now. I was having very, very minor, like abdominal discomfort, some rectal bleeding, a little bit of fatigue, but I mean, I was active, I was working, I was busy. That could have been attributed to anything. So when those kind of symptoms first started, of course, I was a little bit concerned. However, my first thought was, oh, hemorrhoids, oh, stress, oh, you ate something bad, or inflammation, or just kind of all the 100 other things that it could be, right? Because at that point, colon cancer wasn't even on the radar. So after kind of, I'd say about 2 or 3 weeks of that not really subsiding, um, I started Googling symptoms. And I know now, being a patient, that's a big no-no. But in the early days, you want answers, right? You want information. Being 36 again, young adult, I had no reason to believe it was colon cancer. So I legitimately was trying to find some reasons of what this could possibly be. So literally every time I searched something with those symptoms, colon cancer popped up, right? So after about a week of that and anxiety kind of starting to rise and worry and rise and worry, I contacted my GP's office and decided to make an appointment. So side note, before I get into that visit, my GP is amazingly supportive, and has been this whole time. But there was a little part to this, to that visit, that I think really speaks to this presentation. So this was all during the pandemic as well. I just want to add in, it was like, so it was just another layer of already chaos going on. So I went to this appointment by myself after my wife encouraged me, to really go get this checked out, because I've been, I was pretty nervous about it, and I was asking questions, and the anxiety and stress started to rise of kind of what could be. So I made an appointment with my GP. We talked about the symptoms. Um, I was meeting with one of her residents, and he was great. He asked all the right questions. He was asking me about symptoms. He did an exam. He did a rectal exam, the standard stuff you hear with everybody. And once we finished that, he kind of goes, well, I really think this is hemorrhoids, right? So I said, okay, fair enough. You're the doctor, right? But I guess he was able to tell that I wasn't sold. So he said, well, is there concern? Like, what are you worried about? And I full out said, well, I've Googled a lot of my symptoms. Um, and every time it pops up, colon cancer. And he looked me right in the eyes and he was like, Mr. Abramovich, you're 36 years old. He's like, this is not cancer, right? And this was a new doctor, a resident still, that had like just recently gone through med school at some point in the recent years, right? So now looking back, it's kind of like, holy geez, like how many med school residents are out there that have not been made aware that, early onset colon cancer is a thing, right? And when you hear a doctor say, um, oh, it's just hemorrhoids, like, of course it's a relief because you know what the alternative is, so you want you want to believe that. But now thinking back, and after all the work I've done over the last few years, like it's quite disheartening in a way, because I'm one person, right, that went on to push for further testing, but how many others like me are there out there that just take the doctor's word for it and don't follow up, right? Or don't advocate or don't push just because the doctor maybe is not aware that the rates are on obviously a huge rise, as you spoke to, right? So luckily, after I talked to the resident, my actual doctor came in, just to kind of follow up and kind of tie up loose ends or whatnot. And she was great. She basically said, like, it's very unlikely, but I think given your symptoms, I'll absolutely refer you for a colonoscopy. So I said, awesome, exactly what I went in there for. Given that this was a pandemic, I was about 2 or 3 months, if not more, off for that, because I wasn't really in distress. Like, it was more of an investigative type of like colonoscopy. But she did tell me, like, if symptoms get worse, um, go to the ER. Go to the ER, explain what's happening, and that'll kind of move you through a little quicker. So I guess about a month after that, symptoms really had not subsided. They weren't worse, but they didn't subside. And then I went to the ER. Um, Again, I was really lucky to have an awesome ER doc that, he checked me out. But again, originally he said, oh, this is really looking like diverticulitis, or it could be gastritis or inflammation or the other list of 100 things they tell us young folks, right? So fortunately, though, he said, you know what, I do want to give you a CT, because I don't want to give you antibiotics unless I know exactly what this is. So I got my CT done, and that, of course, showed a tumor. It showed some suspicious lymph nodes, that ended up leading to, a biopsy, inevitably a diagnosis of, stage 3B colon cancer. Um, I underwent a resection. I did 6 months of FOLFOX. I was NED for about 2 years. And then this past September, unfortunately, a little lung nodule was picked up on a surveillance scan. So I was treated with SBRT, and now I'm essentially back on surveillance. So all is good. I mean, like it's been a very, very difficult 3 years, being 36 and getting hit with something like this kind of pulls the rug right out from underneath of you. And what I learned really, really quickly was the system in general doesn't really know how to treat or how to deal with young adults in the prime of their lives while navigating a cancer diagnosis, right? So I had to kind of do my own research. Like, I found some really great organizations like Man Up to Cancer and for social, social and emotional support. I found um, CRAN, of course, like when this other long nodule popped up, just to kind of get some insight and get some of that advocacy in regards to, well, I'm 39 now, I'm back working full time, I have a young family. Um, my docs took great care of me. They put everything into place really quick, but the option I was given was like a pretty extensive surgery, right? So I was kind of looking out for other options. I just knew for the situation was not I could say I could say this. It might sound odd, but it wasn't a bad situation. Like, it had to be fixed, but it was not like a bad cancer, right? It was something that could be treated. They can get it out somehow, and then we could kind of move on. So I just felt that there was something else out there. So I reached out to CRAN. I had an awesome conversation with you, Cassandra, and Philomena, and I was supported and guided to a second opinion as well, which was a game changer. And that second opinion essentially ended up with me receiving 45 minutes of SBRT uh, as opposed to a pretty significant surgery. So, I'm really, really grateful and thankful for CRAN. But I think it really just highlights the fact that, I mean, you guys specialize and really focus on young adults. And my experience over the last 3 years my team is great. I love my team. I love my cancer center. They have not failed me. But it's very obvious that there is nothing in place and there's not enough awareness and education on what someone like me goes through trying to navigate cancer in your 30s when your just life is getting started, right? So I definitely feel that, there's the mental health toll, the financial toll, the physical changes. The way like I describe it to people is I hope one day nobody ever gets cancer, but the reality is when someone's 70 and they get cancer, they might have 10, 15 years of dealing with, um, the mental, the physical changes or whatnot, if they survive. Whereas I'm looking at 40 years, like I'm looking at another 40 years, right, of dealing with the side effects of treatment, the mental toll, bouncing back financially, the stress and stuff that it's had on my wife and my family. Um, it's so different. And there's so many unique needs that I just don't think are thought about because it hasn't really been common up until obviously the last several years where it's been starting to get some attention.
Absolutely. Yeah. Thank you so much, Jason, thank you for your vulnerability, in sharing this experience. Your story will no doubt inspire others, either experiencing symptoms, who are newly diagnosed, or those, going through treatment and seeing you as a stage 4 patient who is just thriving and doing, wonderfully, and going to work and living your life and raising your family. That will no doubt inspire others watching today. So thank you so much for taking the time out of your lunch break and for joining us on this call. Much appreciated.
Oh, you're so welcome. It's my pleasure. And I think if I could just say one last thing is just if you're a young person or know a young person out there that's kind of dealing with this, um, just reach out to supports, like reach out to a place like CRAN, reach out to networks. Don't take no for an answer. Um, just because we're young, I mean, it happens, right? So just don't let that misconception alter the care you get.
Absolutely. Absolutely. Thanks again, Jason. So Jason has really illustrated how important it is for early age onset patients to have dedicated support and resources. So I'm just going to focus on that for the remainder of the presentation. Can we have the next slide, please? And one more. Thank you. So Jason highlighted these needs, these unique needs of early age onset colorectal cancer patients. And within our healthcare system, the traditional models of cancer care often do not address these needs adequately. There are some urban centers of excellence that have unique clinics dedicated to early age onset patients, and they utilize multidisciplinary models of care to really care for the patient in a holistic and a comprehensive manner. Best practices in early age onset cancer address not only the surgical, the radiotherapeutic, and the systemic treatments, but also things like fertility, sexual health, mental health, genetic counseling, and they provide advanced biomarker testing. They provide the necessary family supports like childcare and financial support that are so desperately needed at this time of life. These programs also educate and collaborate with both primary care teams and patient organizations, so the patient can actually be optimally supported and well informed. Finally, access to research studies and to clinical trials is so important in allowing the patient to explore all possible avenues and ensure access to emerging therapies. Next slide. So what is it that our young colorectal cancer patients are looking for when they reach out to CRAN? Well, they're looking for support. They want to know that they are not alone in this terrible, terrible experience, and they want to connect with others who have endured similar emotions, similar procedures, similar treatments. They're looking for information and education. They want to understand this really complicated and often intimidating medical world that they have been, unwillingly thrust into, and they want to educate themselves on the disease. Many want to be empowered with information so that they can be a part of their own decision making, collaborating alongside their care team, rather than just feeling like they're along for the ride. The valuable educational resources we provide at CRAN helps patients to really regain that sense of control that they lost when they were diagnosed with cancer, and it permits them to move forward through their journey with confidence and with competence. And finally, they're looking for advocacy. So learning how to navigate and how to self-advocate within the healthcare system in a thoughtful and respectful manner. And sometimes patients are wondering, am I able to seek a second opinion? Can I access a clinical trial? They feel like they're fighting for their lives, and oftentimes they are, and they want all of the options, all of the opinions available to them. Many patients are interested in emerging therapies, compassionate drug access programs, and some are interested in the drug funding process as well. So CRAN has an entire mandate dedicated to early age onset colorectal cancer, as Jason was speaking to. And essentially, we aim to promote the best practices in diagnosis and care. We want to facilitate patient and expert collaboration through working groups, symposia, and the development of patient tools. Next slide. So next, I'd really just like to highlight a few resources that are really well received by our early age members. Every one of CRAN's resources or programs are completely free of charge, and they are widely accessible. If you or someone you care about is on this journey, please feel most welcome to connect with me or a member of our team or access the resources online. So my colorectal cancer consultant is a highly acclaimed biomarker-driven online tool. It's essentially designed for the metastatic patient or caregiver, and it's to encourage informed and joint decision-making between the patient and their treating oncologist. By completing a series of 13 simple questions online, metastatic patients will have a 37-page personalized report generated for them, outlining, again, it's the potential therapeutic options for the management of their advanced cancer based on their tumor's characteristics and biomarkers. This is an online tool that's been reviewed and endorsed by top experts in the field, and it's updated annually. It is available in both English and in French on our bilingual website. Next slide. As I was mentioning earlier, we do have an entire mandate dedicated to addressing these rising rates of colorectal cancer in the early age onset population. One of these resources is an online My Early Age Onset CRC hub. And what this hub includes is evidence-based information on the disease that's of relevance to the early age population. We have information on Sunnybrook's Young Adult Colorectal Cancer Clinic, which is one of those one-of-a-kind clinics dedicated to that population. Users can access a chatbot, which is moderated by CRAN, and through the chatbot, they can access experts across the continuum of colorectal cancer care, and they may actually ask a question of our medical advisory board members. And finally, visitors to the hub can view brave stories of young fighters within our network to really inspire and encourage others who have been newly diagnosed with the disease. So next, I will speak to our peer support programs. So our My Colorectal Cancer Coach program is a peer-to-peer support and education program. Patients and caregivers can be matched to a cancer coach who can journey with them, helping them to navigate the challenges ahead while providing one-on-one support. Our coaches are actually volunteers, and they complete annual mandatory training and certification, so they gain, the content acumen required to thoughtfully address these inquiries. Essentially, the objectives of the program are to support patients and caregivers throughout their journey, help them cope with personal challenges, and enable them to manage their healthcare experiences, including the treatments required for their disease. This program is digital or virtual, so people can access it from anywhere in Canada, which is really lovely. And it provides, a real sense of connection to others who have endured the journey. The overall result of this program, we hope, is better quality of life and hopefully better clinical outcomes as well. Next slide. So CRAN hosts monthly virtual information and support group meetings. Our meetings provide monthly clinical research updates. We have expert presentations, and then of course we have an opportunity for patients and caregivers to share and learn and connect and just hear about other people's experiences. Since our membership is growing, we actually have stratified our groups. We have a special group for the under 50 population, and we further stratify based on early or later stage disease. And we believe this really adequately allows time to address, those unique needs of each one of the groups. So if you are a patient or a caregiver going through, diagnosis, treatment, or survivorship, please know that you are not alone, and we have a whole community that you can connect with. And our newest program, it's currently in development, is called My Cancer Companion. So we know that peer-to-peer support is a mutually empowering experience, an experience which also enhances the ability to cope with the diagnosis and the subsequent treatment. It perceives improved sense of control, or improves perceived sense of control, and it develops self-management skills. So this peer support, it's actually more effective when participants can connect with someone who has, similar demographics, similar case details, and similar life experiences. We're hoping to connect individuals with someone in whom each peer can see a reflection of themselves. And these shared commonalities, they really enhance the benefits both received and the benefits given through peer support. This new program was actually inspired by feedback from our Young Adult Patient Advisory Council, of which Jason is one of our wonderful members, as well as other patients. And it aims to meet an unmet need in peer support for cancer patients in Canada. This program is going to be launching in early 2024, and it's actually going to be across cancer types. So it's not just limited to colorectal cancer. We'll be doing this across types. Next slide, please. So our early age onset cancer symposia series, we held our last symposium just in October of 2023, and we had essentially a series of 3 symposia originally, and they were dedicated to bringing awareness to the rising rates in young adult cancer, and they were hosted in response to the growing number of young patients seeking support, education, and advocacy. In 2023, we decided to expand our mandate and we covered additional cancer types, which you can see on the screen there. And really what we did was we addressed system level challenges which limited the early detection, and we framed that with a discussion through a value-based healthcare lens to kind of set the stage for advocating for lowering the screening age. We talked about optimal care and treatment pathways, and through that we wanted to incorporate the inclusion of real-world evidence, and we also talked about the value of comprehensive genomic profiling or advanced biomarker testing in helping to improve the patient journey. We talked about strategies to improve survivorship. That's one thing that's particularly relevant in the early age onset population, and Jason really addressed this nicely. But when you're diagnosed with cancer and you survive cancer at a young age, you have a whole life ahead of you of managing the emotions and any side effects. So it's not something that has received as much attention when cancers were diagnosed at a later age. And overall, our symposium really just wanted to improve awareness around both the incidence and the prevalence of early age onset cancers. Next slide, please. And I'm very pleased to share that we will be hosting our 4th annual Early Age Onset Cancer virtual symposium in the fall of 2024. We'll do it across multiple tumor types, once again, to bring awareness around the incidence and the prevalence of early age onset cancers in Canada. We'll include the tumor types depicted in the 2023 symposium, namely colorectal cancer, breast cancer, lung cancer, gynae cancers, liver cancers, and pancreatic cancers. And then we'll add additional tumor types. Essentially what we'll be doing is we'll be building upon the outcomes of the 2023 symposium and exploring research initiatives in the rising rates of young adult cancers. Next slide, please. For those interested in learning more about biomarkers and comprehensive genomic profiling and ctDNA, and how these tools can really help to optimize your diagnosis and inform your treatment selection, we will be hosting our 2nd annual virtual biomarkers conference on June 20th to 21st, 2024. So please save the date for this awesome event. It will be virtual, registration will be free of charge, and all of the information will be available on our website as we get a little bit closer to the event. Next slide, please. Okay, so if you're only going to take away a couple of things from this webinar, this is what I want you to take away. So number 1, early age onset colorectal cancer is on the rise. If you are young and you are symptomatic, advocate to be checked for colorectal cancer. Don't let your symptoms be dismissed based solely upon your age. Also know that if you are under 50 years old and have average risks, so no family history or other medical conditions that would increase your risk, you are excluded from the screening programs. And if you are a patient or a caregiver enduring this journey, please know that you are not alone. Your unique needs can and should be addressed, and there is so much support and information that is available. So please reach out to patient advocacy groups like CRAN, like CCSN. There is a whole network of people out there to support you. So please, please, please go ahead and reach out to us, and we would be privileged to support you. Next slide, please. So these are just my references, and thank you so much. I'm happy to take questions or have comments.
Absolutely, and thank you so much, Cassandra, for that fantastic presentation. So if you have a question, we have a questions tab on the side here. Just put in your questions and we will get to them as soon as we can. One question that I have actually is the point that you brought up about how there is a study looking into potential nighttime light and potentially being a cause potentially of colorectal cancer. Could you go into depth a little bit about what the kind of rationale is behind talking about this, or where that is, if you are privy to that information?
Yeah, this was a study that was actually presented at our early age onset cancer symposium, and the recordings actually will be going live on our website, I think in the next week or so. So you'd be able to access the presenters. It's a research group out of Harvard, and they're noticing that particularly in urban centers, you know, it just never gets dark. And what they're doing is they're going back through the research and looking at what's changed. You know, what's changed since 1950 that might be contributing to the increased risk of cancer, because it's not just colorectal cancer where cancer rates are on the rise. I think there's 14 some cancer types that have been identified to have rising rates in the young adult population. So they're just looking back at what's changed, and then they're doing research to identify if that change may be contributing to the risk.
Excellent. If anyone has any more questions, just please put them into the chat box. And so we talk constantly about alcohol and tobacco use and everything like that, and the Western diet. Now, when it comes to the Western diet and processed foods in general, in some of the research that you have seen, they say that processed foods across the board are potentially cancer causing, but some people believe that that isn't the actual cause. The actual cause is something that is in the processing process. Unfortunately, that's what I have to use, but processing process that potentially is a carcinogenic. Is there any sort of insight that you can give on that, on just how processed foods become so carcinogenic?
That's a great question. I will say, I just want to highlight that, you know, there is no one risk factor. And this is really important to say, especially for patients that have been diagnosed. It's not one thing that you did wrong or one thing that you could have done differently that caused. There should be no, no stigma and no shame associated with the diagnosis. And I know, Trevor, that's not what you were getting at, but I just want to make sure that's clear. It's a multifactorial issue, and there should be no guilt associated with anybody going through the disease. And in terms of the processing, you know, the more heavily the food is processed, and I don't think that it's been identified, at least not to my knowledge, what it is along the way, but the more that something is processed, the thought is that the higher risk that would be associated with that. One of our programs, which I didn't mention in the interest of time, is a My Foods for Life program. So we actually have a registered dietitian on staff, and we have resources available for foods to eat to be lowering your risk of cancer. And our dietitian actually connects with patients or people interested in cancer prevention for one-on-one personalized consults to help provide that kind of information.
Excellent, and thank you for sharing that resource as well. And all of these slides will be available afterwards, and it doesn't really seem like we have any more questions, so thank you very much, Cassandra, for that talk. Thank you very much for the work that you do, and we appreciate you here at CCSN as well. So thank you very much for this chat.
Thank you so much for the invitation, and it was a pleasure, and I hope to hear from anybody who we can help.
Excellent. Now, this is just one of a series of webinars that we are still holding. We still have time left in the year, so we do have a couple that are in the works. So if you want to keep in touch, follow us on our social medias, and also go to our website, survivornet.ca. And also the best way to be in the know about these webinars is to join our webinar and our email list. If you can't see those webinars or those emails are not showing up, just look through your third party, because emails now go into multiple inboxes, so just have a look on there. And all of our webinar series can be found on both our YouTube, SurvivorNet, or on our website as well. So I'd like to thank everyone for attending today's webinar, and I hope you have a fantastic afternoon. Bye for now.